Qual è l'impegno di Novartis in ematologia e quali sono le novità più interessanti presentate dall'azienda all'ultimo congresso della European Hematology Association, l'EHA, a Milano? Noi l'abbiamo chiesto al dottor Dushen Chetty, Global Head Oncology Development di Novartis, che abbiamo incontrato proprio a margine del convegno dell'EHA. Dr. Dushen, at this year Congress, Novartis presents new data across several hematologic indications. Which results are you most excited about and why? And what do these new data mean concretely for patients, both in terms of efficacy and quality of life?
We're very excited this year to present 42 abstracts at EHA. And the ones that I'm truly excited about are, firstly is asciminib, which is used for CML, and we're presenting a study called ASK4START. And this is important because it shows how asciminib can be safer than second generation TKIs. And those are some of the data we're presenting. The other study that we're presenting is with iptacopan and called the APPULSE-PNH study. In that study, it's for paroxysmal nocturnal hemoglobinuria. And in that study, we're showing that patients who are on anti-C5 therapies, when they're switched to iptacopan, their hemoglobins can still rise. And the third study that I'm excited about is for ianalumab, for immune thrombocytopenia. With ianalumab, we've done a third-line plus study called VHIT-3, and we're showing the data from that study, how patients are achieving responses even in very late lines of therapy.
And do you see any of these findings reshaping treatment paradigm in the near future?
Yes, absolutely. For asciminib, I think the important results that we've shown for the ASK4START study will show that we can have effective, safer therapies for patients who are newly diagnosed with CML. And with iptacopan, what's important about the success of iptacopan in the APPULSE-PNH study is that it shows that you can switch patients to oral therapies, and patients are very much in favor of these oral therapies. With ianalumab, the study had only 4 doses of ianalumab, so a short course of therapy, and it saves patients from having very prolonged therapies with side effects throughout their treatment. So all of these 3 studies show that they're very patient-centric, they improve tolerability and have short courses of treatment for patients.
And what can clinicians and patients expect from Novartis in the next waves of hematological treatments? That means, which are the most promising treatments in your hematologic pipelines?
We're very excited about 2 new platforms where we're developing therapies. One of them is a next generation CAR T program called YTB, and this is for the treatment of patients with large B-cell lymphoma, but it's different from traditional CAR Ts in that there's a short manufacturing period, only 2 days. These cells are then reinfused into patients and they expand in vivo, and the cells maintain more stemness, and so as a result we expect better outcomes for patients. The other therapy that we're excited about is a CD19 trispecific. So with the trispecific we have developing for lymphoma, a CD3 arm that engages the immune cells, and also a CD2 arm that helps with T-cell exhaustion. So those are the new therapies that we're excited about at Novartis.
You are the new head of oncology development at Novartis. Which is your vision for the company's future in hematology, and how does hematology fit into the broader oncology strategy of Novartis?
We've been pioneers in oncology for over 20 years, so oncology will continue to be a central pillar of what we do. We'll continue to innovate and bring new therapies to patients that meet unmet needs that patients have. And my priorities as new head are firstly to deliver the pipeline, so deliver the products which are in development, especially the new CAR T and the new trispecific. I'm also very keen to look at complex technologies. We've pioneered many complex technologies, so we're keen to innovate on even newer technologies. And finally, we're very open to partnering, so you'll expect to see several BD&L opportunities, partnering with other companies to bring even more therapies to patients.